Fucking double poke, both eyeballs.
Oh my gosh, so honestly, as a retina surgeon, that was a little bit too gory for me to watch. My friend texted it to me and he was asking me what I thought about it. Just seeing that as a retina surgeon who operates on people who sustain severe eye trauma like that, my brain immediately went through the worst case scenarios that could have happened. An optic nerve avulsion, which is very rare but can cause immediate blindness, retinal detachments, retinal dialyses, commotio, traumatic maculopathy, traumatic iritis, cataract, you name it. Like here, if you look at this eyeball, so here's the eye from the front and here's the eye from the side, a cross-sectional cut. A finger to the eye that hard, from the front part of the eye to the back, you can cause a corneal abrasion. So even if it's a really, really tiny corneal abrasion, can cause severe pain. We're talking even the toughest of men, you can have like a millimeter of a corneal abrasion and they're in severe pain. The cornea is one of the most highly innervated places in the body, so severe pain. From that, you could have traumatic iritis where there's a lot of inflammation, and there are videos of him complaining about how the light was bothering him a lot. That's called photophobia, and if you have inflammation in the eye from an eye poke like that, that can also be very uncomfortable, cause vision loss, vision problems. Here you have the lens in the eye that should be crystal clear like this and in this position, but if the eye sustains an injury like that, it can cause this to change in color. That's called a traumatic cataract. Or this lens itself can be pushed out of its original position and get dislodged. We call that a dislocated lens. You can see there are these zonules that hold this lens in place, but that could easily be knocked over by like an eye poke that's that severe. Now we get to the back of the eye. Again, I'm a retina doctor. The retina is the wallpaper of the eye like this. And here you have the optic nerve that connects the eyeball to the brain. So in trauma, what can happen is the retina, which is like the wallpaper of the eye, can actually get torn and it can cause a retinal detachment to happen. And actually in traumatic injuries, a lot of the times the retinal detachments don't even happen right away. They can happen 4 to 6 weeks or actually months later. You can have optic nerve atrophy. You can have to have traumatic maculopathy. This area right here, this bullseye point, but this is basically the most important part of the eye that determines how clearly you see straight ahead. Also, what can happen is you can develop a lot of bleeding inside the eye. We call that a vitreous hemorrhage, where basically the inside eyeball here gets filled with blood and you also can't see. One of the most scariest things, like I mentioned, is where the optic nerve here, the nerve that connects the eyeball to the brain, can actually get avulsed, where it gets completely dislodged. And that can cause immediate blindness. So those were just some of the diagnoses that were running through my brain when I saw that gory video. Poor guy. I really hope he's doing okay. Then what was extra shocking to me were all these videos circulating online saying that because his eye's not red, like his eye's fine. That could be like so far from the truth. Even if your eye, this white part, we call this the conjunctiva, the sclera, this part could be completely white, but the inside part of the eye could have severe trauma. I see patients routinely who have a total retinal detachment, and you can't tell when they look in the mirror, when you look at their face. It's what's happening inside the eyeball. So as of a few hours ago, I saw that he still can't see, which I 100% believe. Again, I'm not his doctor. I'm not involved in his medical care. But just seeing that short clip of what happened, again, these are just some of the ways the eye can get hurt. So I wish him a speedy recovery, and I hope the eye injury isn't as bad as it looks.